Time is up.
It's coming soon. We're launching right now on Facebook, and I just want to see the participants here. We should have here. Does Voice America, do they need to be?
Allowed to talk?
Hello, Voice America people, can you hear me?
Go back in there, unmute it. Okay.
Hello?
Hello, can you hear me?
Yes, can you hear me? Okay, so
Yep.
I have you on. And
Dr. Vaidya, can you hear us?
Yes, I can hear you.
Okay.
Okay.
And,
Who's the engineer today?
You have Matt and Josh.
Okay, Matt and Josh, can you hear Dr. Vaidya? I just want to make
hello,
sure.
Matt and Josh. Good afternoon to you both.
Yep, I can hear him.
Okay, just want to make sure his microphone and everything is good.
Yes, good afternoon to you both.
Now,
Is he using a microphone or is it the internal mic on the computer?
I think he's got a microphone outside his computer, like a big ball thing.
Yeah.
Do you
Okay,
need to change?
could you take your finger and hit that microphone, scratch it so I could hear it?
Dr. V, can you scratch your microphone so they can hear the sound?
Okay, yeah, it's up and running. All right, yeah, just make sure you lean into the microphone when you speak. Be okay.
Yes. Can you hear me?
Yeah, if you want to bring it a little bit closer to you, that'd be better.
Okay. Can you hear me now?
Yeah, that's good. That's good.
Okay. Good afternoon to you both.
Thank you. Good afternoon.
Yeah.
Okay, how much time do we have?
We have about 1 minute and 12 seconds before the open. And I did send a little hello on the messenger. Make sure that's popped up. You guys can see that right on the chat.
See it on the chat. I don't see anything. Oh, I see. Hello, hello.
Okay, perfect. Thank you.
Hello. I cannot hear you, Marine.
Oh, I'm not talking. I'm
Oh,
just waiting a couple of minutes.
Okay.
We're
All
not.
right, we're 30 seconds to the open.
30 seconds. Thirty seconds. Get over here.
All right, sending you the feed.
Okay.
Expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Welcome to Take Back Your Health. Your hosts are Dr. Sunil Pai and Maureen Sutton, who will explain the shocking truths about healthcare, prescription drugs, food and supplement industries. They will help guide you to take back your power and feel great again. Now, here's Dr. Sunil Pai and Maureen Sutton.
Welcome, everybody, today. My name is Dr. Sunil Pai. What a great show. First, before we start today, we want to give a shout out to all our listeners. You know, we've had a great response with our first couple of episodes, and we had people all over the world listen. So I just want to shout out to countries outside of the United States, which is really important that we're getting an international audience as well. And we have China, we had Norway, we had Ireland, we
Australia,
had Curacao, Trinidad, Tobago. We had a lot of countries in Europe, South America, Mexico, and Canada.
Thank you for listening.
So thanks, everyone, for tuning in, and hopefully you can continue sharing this program, Take Back Your Health. Today we have a really important guest, but before we get to our amazing guest, I want to kind of preface what the show is going to be about, is how to lower inflammation naturally. And before I get into even that with the solutions, we want to talk about what is our current problem. You know, one of the things that I've done in writing my book, An Inflammation Nation, which you can get at aninflammationnation.com, is really teaching people the concerns about what is a black box warning. So I want to first start off with explaining to all the listeners out there what is a black box warning. And if anybody has taken any kind of drug, there's an insert in the drug, and it will say two things. It'll say it can have a common side effect and a serious side effect. And a common side effect is simple things like heartburn, diarrhea, rash, ringing in the ears, swelling in the ankles, for example. And a serious reaction could be something life-threatening, like a heart attack, a stroke, a GI bleed, or bone marrow suppression, or liver dysfunction, for example. Now, when a drug comes out, it has a monograph, it'll have common side effects. So almost every drug has a common side effect, which is not going to kill anybody. But when those drugs have serious side effects, and those serious side effects start occurring more commonly, daily, and it outnumbers sometimes the amount of common side effects, there's something what they call a black box warning. And hopefully, for those people on Facebook Live today, can see the black box warning here on my slides. Is that basically this warning by the FDA means basically that you can end up in the black box. Yes, the square little box, the little casket warning. So these are things that actually can kill you. And each drug, not every drug has it, but a lot of drugs do. And today we want to talk about why that's important, because what we're talking about with black box warnings is common for non-steroidal anti-inflammatories, all non-steroidal anti-inflammatories, which are things like, let me tell you the following, like ibuprofen and Motrin and Advil and a Celebrex, which is celecoxib, and Aleve, which is naproxen.
Yeah, but you know, when you open a box of one of these things, I've never seen a black box warning in there.
Actually, that black box warning is in the insert of every single drug. It's also listed on the commercial. It's also listed on every type of product. So if you were to have a bottle, for example, of an ibuprofen product, and once you tear open up over that cap, you've actually accepted the terms and conditions that the black box warning can have. So the problem is then, once there's a black box warning on a product, there is no legal liability if you have any of the serious reactions that occur. Now, the interesting thing is, what is the black box warning for non-steroidal anti-inflammatories? So 1/3 of the American public takes these kind of products a day. Again, they're not steroids, but they're anti-inflammatories, right? Ibuprofen, Motrin, Advil, Aleve, Celebrex as the brand names. It's 1/3 of the population takes this daily, over 80 million prescriptions prescribed a year, and over 30 billion of those tablets were purchased last year. But what's the problem is that with this class of drugs that are used over the counter and by prescription is that they all have a black box warning. And the black box warning for these anti-inflammatories is that you can have a heart attack or a stroke, or you can have a GI bleed.
That's serious. Yeah, it is
serious.
A black box warning.
An ulcer, stomach intestine perforation, and it can occur any time without any warning symptoms.
Even the first time you take it?
Even the first time you take it. So you don't have to be an ibuprofen junkie to have this. You don't have to be taking multiple pills a day. You can say, I just have menstrual cramps once a month. I just have a headache. I was just lifting something out of my car. I was playing with my kids. I was playing some sports. I throw 1 or 2 ibuprofen in, and bam, you can have a heart attack, you can have a stroke, and you can have a GI bleed. Now, that happens more often than people think. So what I want to talk about today real quick is that most people don't know that not only are these things dangerous in terms of heart attack, strokes, and GI bleeds, which occurs more commonly, but it actually degenerates the joints. Okay? So when we take these kind of drugs, it actually will worsen the arthritic joint. Okay? And you'll see more in my book. I'll cover that. For those people who take it for arthritis, over time, you actually will get more arthritis. Within 2 years, we can actually see changes on an x-ray. So one of the things that I want to talk about is not only just degenerating the joints, but how many people are dying from taking this drug. And more recently in my book, I have a lot of this data, and we have the graphs, but I wanted to show people who are on Facebook today is that from 1984 to 2009, almost 300,000 people died just from a GI bleed taking non-steroidal anti-inflammatories.
Wow, and people eat them like candy.
Like candy.
And you buy gigantic jars of it from Costco.
Right, 2,000 caplet bottle, right? And they send twin pack for discount. So we have to be careful. You know, it costs about $3.38 billion, and how many people were hospitalized is amazing. Now, when we look at what is 300,000 people, let's take a look at what does that mean, because a lot of people miss what those numbers mean in terms of morbidity and mortality. And we look at that 300,000 people who have passed away in those 10 years is more than the Revolutionary War, the War of 1812, the Mexican-American War, the Spanish-American War, World War I, Korean War, Vietnam, Persian Gulf, and Iraq and Afghanistan combined.
Combined.
Okay?
That's incredible.
It's incredible. So more people have died, and more people have been hospitalized at 1.7 million people.
And we never hear about this.
Than all these casualties for 1.4 million. Okay, so we have to look at now the number one cause of death now in the United States is medical errors and side effects. And the largest category of those medical side effects is the non-steroidal and anti-inflammatories. 100,000 people will go to the hospital every year just to take these things, and over 22,000 will die directly from this drug. That is like 4 to 5 times more than 9/11.
Well, that's pretty frightening.
So there's no war on NSAIDs, which there should be.
So what can we do about that?
So what we can do about it is, first, we want to lower the inflammation naturally, okay? And aside of lowering inflammation, we always want to also increase our immune system functioning. So what we take in our office is we take something called Glucan 300. And if you go to Pure Beta Glucan, that's purebetaglucan.com, you can understand and learn a little bit more about how beta-glucan can help you and your immune system keep it strong. We take it every day. We recommend our patients.
Day. Mm-hmm.
And if they go, if the listeners go to the website, purebetaglucan.com, and if you purchase that, you can go on checkout and put promo code PAI for a discount. So again,
can
Pure
we show
Beta
this
Glucan.
on the screen?
Yeah, so it's going to look
people
like
can see
this. It's one of the best products out there. So now, what do we
That's
do?
for your immune system.
This is for your immune system. Now, let's get back to talking about what we got to do for lowering inflammation. And one of the special guests that I have today is one of my favorite colleagues, one of my favorite people of all time. His name is Dr. Bharat Vaidya. And Maureen, I want you to just tell the audience a little bit about him.
And you both also are my most favorite.
Thank you.
Dr. Bharat Vaidya is my beloved teacher, Ayurvedic teacher. He's a renowned Ayurvedic physician. He received his Ayurvedic degree, the BAMS, and advanced medical training in Mumbai, and obtained a medical degree from the prestigious Catholic University in Leuven, Belgium, in Europe. He brings to the table over 7 generations of Ayurvedic medicine. Welcome, Dr. Vaidya.
Thank you very much, Maureen and Dr. Pai both. I am highly obliged. Thank you very much.
Now, I want to tell the listeners real quick before you get a little bit into describing what Ayurveda is shortly, is that Dr. Vaidya is a true integrative physician. So he's trained in Ayurvedic medicine in India as a degree from being an Ayurvedic doctor and an MD in Western medicine. So this is kind of the perfect person to go to when we look at integrative medicine. So Dr. Vaidya, can you tell the listeners a little bit introduction of what Ayurveda is and a little bit about your practice and your school?
Ayurveda is ancient holistic medical science. Ayur means life, Veda means science. So it is actually science of life. Why it is important and why still it is a living force? Because Ayurveda born from the idea Vasudhaiva Kutumbakam in Sanskrit means world is one family.
Yes.
Wonderful.
Second is that Ayurveda is a compilation of knowledge by various culture. So every culture has contributed greatly in the development of this science. That is why it is still a living force.
And can you tell the listeners how old Ayurveda is?
Ayurveda actually, it is one of the most ancient science which has no beginning. Actually, you can say Vedas are the seed of the Ayurveda from where the tree of the Ayurveda has grown. And if you put the date of the Veda, then there are different timeline we are getting from different scholars. But if we go and compile everything, then it is more than 10,000 years old, I can say that, and I can put that in perspective.
Right.
So this is the original medicine.
This is the original medicine, and this is the medicine by our ancestors, which was tested from the thousands and thousands of years by our ancestors, our traditional doctors, Vaidyas, everyone.
Right. And one of the things that the listeners should understand is that, when we look at something traditional like Ayurveda, which even from the 80s, the government of India has a multi-system approach of healthcare, and Ayurvedic medicine is one of the formal approved and recognized medicines of India.
Yeah,
so just culturally, but even in the modern time, it has been brought forth. And go ahead and continue a little bit more about.
In that case, I have to mention over here that actually it was my great-great-grandfather who established first modern college of Ayurveda during British Raj in Bombay in 1896.
Wow.
And
that's history.
And at that time, Persian, Europeans, And so many people were studying in that school and even graduated from that school.
Right. And what many people don't know, and this is something that when I went to India with Maureen and we studied a little bit of Ayurvedic medicine in our hometown with the medical Ayurvedic medical schools there, is that, Ayurveda is rich of not only just the science, but all the 8 branches that we use today in conventional medicine. Most of us, we think of like Hippocrates, the father of modern medicine, but that's more Western European medicine. But when we look back at surgery, psychiatry, pediatrics, OB-GYN, internal medicine, toxicology, rejuvenation, pediatrics, these are all categorized in Ayurvedic medicine, and that was translated more into then when the Greeks and Romans came, and eventually to Western medicine.
You forgot surgery. Surgery is very important.
Yeah. And actually, there are the 8 main branches of Ayurveda, which includes everything what modern medicine now has with them. And Shushruta lineage was pioneer in the surgery. Shushruta was the first most profound surgeon, and some of the even operation in surgeries, what you see in the modern times, the base of those surgeries is coming from the Shushruta. That whole flow is coming from the sage Shushruta, or one of the profound surgeon of that time.
Dr. V, we'll hold that thought, and we'll be right back after these sponsors' messages.
You're clear?
Okay. Sorry about that. All right, everybody on Facebook Live, we're here with Dr. Bharat Vaidya. We're talking about Ayurvedic medicine and wonderful things to talk about. We're going to cover a little bit more within the next couple of segments. We're going to provide a lot of solutions of what you can use. But as Dr. Bharat, and when we come back from the break, we're going to talk about surgeries. Okay, why don't you come back?
I'll be right back.
Maureen will be back. So. If you want us to start talking a little bit now, we'll be back in about 3 minutes or so. But, one of the interesting things that people don't know is that the branches. So when we look at the science now, everybody's talking about rejuvenation, anti-aging, all this, but that goes back. Rasanayas and rejuvenation medicine goes back thousands of years. And so now we're understanding adaptogens, we're understanding certain factors for immune system and inflammation. And those things are nothing, even though we think of them as being new, they're actually things that have been around forever.
Yes, and it is a part of our nature. Nature has given us everything, okay? And rasayana, the word you have used, okay? Rasa word literally denotes life. Water is a rasa, life. Mercury is a rasa. Abstract is a rasa. Juice is a rasa. Rasa literally rasa word literally denotes life. And rasayana, by taking
back in 20 seconds
medicine by which you can enhance your lifestyle, by you can the way you have said adaptogen, okay? So all the kind of rasayana which are help you to maintain your health, improve your immunity, the way the product what you were showing, improve your immunity and stop the chronic or other inflammatory diseases, autoimmune diseases, and prolong the lifestyle.
Wonderful. That's great. And we're going to be talking about those, and also we'll be offering, if you go to Sanjevani Store, Sanjevani store.com, you'll see a lot of Ayurvedic herbs and products. All the products have been GMP complied, and they're patented ingredients. We'll talk about some of them today. But we have a variety of products that can help with sleep, help with sexuality, help with calming the mind, helping improving immune system function, stamina, energy, memory. So definitely for those who are looking at Facebook Live, sanjevanistore.com, and we'll be able to provide a wonderful array of Ayurvedic products.
All right, stand by, coming back.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Welcome back, everybody. I'm Dr. Sunil Pai, and if you're just checking in and tuning in right now, we're speaking with the world-renowned Dr. Bharat Vadia, a wonderful Ayurvedic physician and MD physician, both combined.
And my beloved teacher.
And Maureen's teacher. She's actually getting
I'm honored, Maureen. I'm honored. I'm highly honored. Okay.
So,
I'm honored.
One of the things we were talking about before we went to the break was Sushruta, and just real quick, I want to make something really important because a lot of people think that Ayurveda is ancient and also kind of old. In the sense of like, well, what did they have back then? But Sushruta, which is the father of surgery in Ayurvedic medicine, actually created what we call the Sushruta flap. You know, my father's an ENT, or he's a retired ENT, and one of the most common things that we use in surgery today is the forehead flap when someone's reconstructing the nose. And that whole forehead flap where they take the muscle and they flip it, they reconstruct the nose, is called the Sushruta flap. So this goes back, you know, decades, centuries and centuries and centuries ago, surgical technique that is used today by any kind of plastic surgeon or facial reconstructive.
Yeah, here I would like to say something very interesting.
Sure.
There was one soldier which was coming back during that time, I can say around 1850 or 1860, when he was coming back from war with Tipu Sultan, okay? And he was a part of the British infantry. And he was caught by the enemy and his nose were cut off, okay? Ooh. And then one of the cobbler in Pune, how he reconstruct his nose, some of the doctor from British presidency, they look at it and they were amazed, and they asked him that from where this all knowledge came, and he explained them that this is coming from the old text of Ayurveda or Sushruta, in which the most advanced form of the plastic surgery is mentioned, and this science is borrowed by our European surgeons, our brothers, just 200 to 250 years ago from India.
Right. Wow.
So it may be ancient or old, but it's not outdated at all.
Many surgery, what you see, including entering into the stone and taking out the stone, etc., the base is Sushruta.
Right. Mm-hmm. So one of the things inside of surgery is looking at now injury and inflammation. Mm-hmm. And today we're talking about how to lower the inflammation naturally. And using a combination approach of Ayurveda and Ayurvedic medicines, we're looking at how do we lower this inflammation naturally without the side effects, without the black box warnings. And one of the things, you know, that we see is, you know, again, here's a little picture here.
I love that.
Of C4, C4. Can you tell me what the C stand for?
So the C stands for curcumin.
Curcumin.
I'm curcumin. And so one of the things that we like to look at is of the main staples in Ayurvedic medicine, and what we like to use is 4 ingredients. So Dr. Bharat, I want you to talk a little bit about the historical use of turmeric, boswellia, ginger, and black pepper, and then I'll kind of talk about the scientific studies and now how we process that and how we can deliver those things in nutraceuticals.
So we want to talk about curcumin?
So first, would you like to go about the curcumin or curcumin longa, which is known as turmeric? Turmeric is naturally anti-inflammatory and a painkiller. One of the biggest contribution of turmeric is actually, it is a blood purifier. It is excellent blood purifier. And through the way it works through the liver, blood, and plasma. And it helps to purify the plasma, and plasma contains immunoglobulin, gamma globulin, and through the HB and HB sources, turmeric help immunoglobulin and gamma globulin in the plasma. At the same time, turmeric with another herb which you have mentioned over that is a ginger, both the combination of it, they are the excellent combination for the controlling the eosinophilia, which is a prime indicator of the inflammation in the body.
Absolutely.
And allergy.
Parasites, a lot of inflammation.
Exactly. And that is where comes the turmeric. And turmeric is a natural anti-inflammatory, and working through the blood and blood molecules, it helps to reduce the inflammation. It helps reduce the eosinophilia. And at the same time, it helps the immunoglobulin and gamma globulin in the blood and help the liver And that's how the turmeric is very helpful for the body. Not only that, but if you are giving turmeric in the inflammatory patients, then the first response you will see with the chemical of the curcuma lunga is that patient will feel extreme relief within the few hours. At the same time, the vitiation of the flame or inflammation will go down.
Right.
And it works even faster when you use and better when you use black pepper with it, correct?
Yes, exactly. And black pepper is natural anti-inflammatory, but at the same time, it is excellent antiviral.
Right. And one of the things that we use the black pepper for is black pepper has been patented in terms of the extraction of what they call piperine compounds.
Yes.
And it's been shown when we use it with the curcuminoid, specifically the C3 complex was what we use. There's 3 specific curcuminoids from turmeric. And at the specific ratio of how it's extracted, those 3 can increase the absorption with the black pepper about 2,000%. So we're looking at, it's a bioavailable enhancer. And we now know that with the C3 complex that we use in Bosmeric, which is our product that we've been using now for many years on thousands of patients worldwide.
Can't live without it.
We have over 63 or actually 65 clinical studies that have been published, that are not from us or biased from us. These are independent. We just provided the supply, and it's been independently published at hospitals and major universities around the world and in the United States. Is it that the curcumin C3 complex in our product lowers around 97 different mechanisms of inflammation. It also upregulates and downregulates gene expression appropriately. So, curcumin is what we call, the gold, the golden herb, the golden spice.
Golden herb, golden milk at the same time.
Right.
Actually, it is excellent blood purifier, and when pure blood, pure nervous system, and naturally reduce the inflammation. Okay. At the same time, one of the chemical in curcumin lunga is excellent as a natural antibiotic.
Right.
Okay. So it is one of the best antibiotic, and at the same time it is anti-inflammatory. And when you combine with the black pepper, the way you say, Dr. Pai, it is excellent antiviral plus anti-inflammatory. There is an excellent combination of, and if there are 2 kind of black pepper you see, when you take out that black cover, then it is a white. And that white paper of the black pepper, which was used by Bapalal Vaidya, founder of Surat Ayurvedic College in 1940s and 50s with curcuma lunga turmeric to treat the inflammation, especially in the eyes.
Wow.
Oh, you would use white pepper with the eyes.
Excellent for the
fascinating
eyes when you use with the curcuma lunga. Okay, and these are the natural approach which can prevent the pressure in the eye and including help to in the glaucoma also post-operative or pre-operative.
Wow. That's amazing. And so people need to understand is that, we always talk about food as medicine. And so keeping, these are all foods. These are all foods that people should be eating. And if they eat these foods, for example, with turmeric or ginger or black pepper, it always should be organic because these foods are heavily sprayed commodities right now. They're root crops, right?
And then you can find from your pantries. And as you said that you asked me that, can you talk, Dr. V, about your school? So we have Ayurveda Sadhana School, which is connected with the Prabhuram Ayurvedic Educational Trust in Mumbai, India. And we have opened this school, which is actually regulated by Colorado State and which is approved by the Colorado State. We have the 3 programs, practitioner program, advanced practitioner program, and one of our excellent power program is Ayurvedic pregnancy and nutritional support program. And when one of the class of the herbology or Nighantu, we ask the people the way you say that these are all actually food. This is coming from our pantry. So
food
one of
is
the
medicine.
Yeah, medicine. So actually, Marine knows that one of our requirement in our Nighantu class is small public health research. When you go and take one community and you can go to certain houses that ask that how much the spices they are using in day-to-day uses.
Wouldn't it be wonderful if our listeners would write in and let us know what spices they're using in their home?
That would be great. And also what we want to make sure is that if anybody's interested in learning about Ayurveda and actually getting certification and training as becoming a practitioner or even with pregnancy and nutrition or a variety of courses, you can go to Ayurved Sadhana, Ayurved spelled
AYURVED
Sadhana, SADHANA.com, and we'll have that on the link at the bottom of the page. But definitely go and take a look for looking at an authentic class. One of the things is that there's many courses and schools they call quote unquote schools in the United States, but we're looking at something that actually has a really strong curriculum that's based on 7 generations of information and the actual knowledge. So this is not some kind of holistic kind of sort of pseudo. I'm just going to take a few hours. It's a very, very long course. It's very important that there's a lot of physicians, a lot of healthcare providers that are taking this course from Dr. Bharat Vaidya, and they also have trips where part of the training they actually go to India and actually get to see it in Ayurvedic medicine in practice in Ayurvedic hospitals. So what a great place to go. After the message coming soon, we will then talk and continue finishing this discussion on what other anti-inflammatories naturally you can take.
Yeah, so we can finish that, and we can finish that also.
So we can talk about boswellia, we'll talk about ginger, we'll even talk about something really interesting and cool, something called Shilajit, or we like something called Pure Black, and that's something that definitely we want to talk about after we come back from a message from our sponsors.
Yes.
That's another thing that we take regularly.
We're clear.
Thanks.
All right, so everybody on Facebook, we're talking here with Dr. Bharat Vaidya from Ayurved Sadhana. Go to his ayurvedsadhana.com, and today we're going to talk a little bit about Pure Black. Before we even talk about it, we're going to show you what it is. Pure Black is a mineral pitch. It's called Shilajit in Ayurvedic medicine, and Dr. Bharat, when we come back from the break, he will talk about it also after we finish talking about boswellia and ginger. But this is what it looks like. It's called Pure Black. And one thing is that we understand is that Shilajit, which is a mineral pitch that comes from the Himalayan mountains in Russia.
Show the inside
This
of
is
it.
the inside. It looks like a tar, like a mineral pitch. It's really difficult to find good, pure sources. And in fact, it's one of the most adulterated products that you can find. And so what we've done is we've been able to find a manufacturer that actually, if you look at every single bottle, there's even a lot number here. And it's traceable even on the boxes. Every box will have like a code, okay, and it's traceable all the way to source. And on one of the shows, we'll actually have the patented owner of the process of how they get this. They actually extract it, and they fly in helicopters. This is actually coming from Russia. Trump's not involved with this product, so we don't have to worry about that. There's no investigation here. But they actually fly the biologists in helicopters. They drop them down. They actually find core samples of the rock, and then they extract the rock when it has the right course of the minerals altogether. And this has humic fulvic acids. This helps with memory. It helps with energy. Helps with detoxification. So it's a wonderful thing. It helps with recovery with injury. Dr. Bharat, after the break, will talk about more of this in general. But it's really interesting. It comes like this, and there's
20 seconds and we're back.
There's a little spoon here, and you take about a pea size out, and then what you'll do is you'll take that pea size out, put it in a glass, fill it with water, and just let it sit for about 20-30 minutes. It will dissolve naturally, and then you just drink that one shot a day. It does have like a, we call it muddy water taste because it's a mineral pitch, it's a live resin, but you'll feel amazing, and you'll have results very quickly.
And it helps all of your other supplements or herbs, whatever you're taking, to work better.
So if you take the Shilajit or the Pure Black with bosmeric, you'll get actually an improvement of the bosmeric effects.
Okay, so.
All right, coming back, stand by.
Okay.
So.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Hi, everyone. We're back. I'm back with Dr. Sunil Pai and Dr. Bharat Vaidya.
Yeah, before the break, we were talking about the wonderful aspects of turmeric lowering inflammation, 97 different mechanisms of inflammation, and also the combination use with black pepper itself as an antiviral, anti-inflammatory agent.
Antibiotic.
Right, antibiotic, and also helps increase the uptake. But now I want to switch to another important ingredient, because this is really very popular on the internet, very popular on social media, is boswellia, which most people know as frankincense. Tell us a little bit about boswellia and frankincense.
So boswellia, one of the main ingredients by which it works as an anti-inflammatory is acetyl keto-beta boswellic acid, which is known as AKBA, which is one of the main ingredients into it. Right. And in Ayurveda, it is known as shalaki or salai gugulu. In 1930s, I told you that Ayurveda is compilation of knowledge by various culture. Father Nun has described very wonderfully about this whole shalaki or salai gugulu, and it was used not only for the inflammation but even as an air purifier.
Right.
And this is a resin, and it is an excellent air purifier which can also help to reduce or to remove the bad microorganism from the air.
Right.
Okay.
And one of the things that we've seen with some modern studies is that, you know, most people burn the frankincense, the actual resin, in, say, religious ceremonies. And we do studies that where they now know when they burn it in church, for example, this has also been documented in the research studies in my book, is that on functional MRI of the brain, when people smell the frankincense when it's burned in the church, it stimulates the part of the brain which is the calm center. Right, so what a best place to be is in church when you feel safe. Is that the smelling of the frankincense actually puts you in that focused, relaxed, calm state where we can then feel safe, or we can pray or be in the house of worship with our community, for example. So a lot of things: air purification and also keeping the body cool, and calm. One of the things, though, we have to make sure is that this AKBBA. There's other parts of this boswellia that's important, boswellic acids, and something called polysol. And polysol is now a polysaccharide fraction, which has been patented, that's in our bosmeric.
It's water soluble.
That actually makes it water soluble. So when people take bosmeric, it has a 20-minute onset of action. That means like a fast tab, bam, it's in the body, it's kicking in, and then it has a sustained release over 8 hours. So you can basically get almost all day relief from taking this 20-minute onset of action, 8-hour sustained release. Now, boswellia, though, one thing is that most of these compounds are different than what's found in essential oils. So remember, it's a gum resin. So when people say, oh, I take boswellia, frankincense essential oil, it's different. It doesn't have those strong anti-inflammatory effects because it's lacking these components that are not found in the essential oil extracts.
Right, and there's been many studies on the frankincense oil in cancer studies, correct? Right. And so they found that it's not the frankincense oil that works.
Right. It's actually other ingredients such as myrrh and other aspects
it's myrrh.
that have strong aspects. So tell us a little bit about boswellia. Any other uses, Dr. Vaidya? I know that we use it in Ayurvedic medicine for lung inflammation, brain inflammation. We have studies with asthma. And also with actually brain tumors as well.
Tumors,
asthma, brain tumor, and it is actually excellent to remove the microorganism from the body, bad microism, so that we can help the cellular biology. One of the Japanese scientists have recently proved that some of the components in the cellular biology are responsible to create the chronic inflammation, and it leads to the autoimmune and chronic diseases. And that is where boswellia comes, or salai gugulu or shalaki comes, which can help tremendously to reduce, because when we are talking of the microorganism, we are talking about endocrine system. When we are talking about endocrine system, we are talking about the metaphysical planes. And these natural herbs has capacity to reach up to that metaphysical planes and can work wonderfully and naturally, and can reduce and actually remove the cause or the root of this inflammation. And that is where this boswellia comes. One more thing I would also like to tell you, that Sir James Watt, in 1889 in Ayurvedic Botanical Dictionary, in volume 3, page 751, he noted that actually elephant love this as a food to reduce their own inflammation. Think about Sir James Watt, that he has also studied how these herbs, natural Ayurvedic herbs, help the animals also. We are teaching that also in our Nighantu class, in our Ayurveda Sadhana school, by paying respect to Sir James Watt. But even elephant, it is one of the best food, and you know the size of the elephant, okay?
Right.
They also have the pain. They also have the
absolutely. And one of the benefits is that when we use this in combination, like with the bosmeric, even on the bottle, we actually have a veterinary dose on our bottle because people can give it to their pets. Exactly. We do know that, again, you cannot give non-steroidal anti-inflammatories. You cannot give ibuprofen to a dog. It will kill the dog.
This you can give with the food.
This you can give with the food, and it's safe.
Mm-hmm.
Right.
Exactly, and it is very safe. And another beauty of Ayurveda over here is these gum resin are actually purified by decoction of trifla. Okay. Right. And at the same time, they are hypolipidemic. Okay. Excellent to even reduce the bad fat or the cholesterol. Or in Ayurveda, it is known as Sangatma Kafaj Vikruti, combined vitiated toxin, where also this Boswellia works excellent.
Could you use this for psychological conditions as well?
Yes, because I told you microorganism.
Okay?
Right. We are endocrinology.
Right.
Endocrinology means metaphysical planes. And there comes manova shotamsi, or psychology. Okay. And there it works excellent. No doubt about it.
And also when we look at inflammation just in general, we know that inflammation in the brain can affect mood disorders. Inflammation in the gut can affect mood disorders and neurological conditions.
Absolutely.
So the benefit of all these three things are great. Now let's talk about the fourth ingredient, ginger.
Yeah. So when you just now say, Dr. Pai, about the gut, okay?
Right.
Many people don't know that it is proven by the modern medicine. And when I was in Catholic University of Leuven, Flanders, Belgium, we were actually working with the good gut biome, and highest serotonin is produced in duodenum.
Right.
And in duodenum, in Ayurveda, known as Agni Dhara or Pitta Dhara Kala, where the Agni or digestive Agni is reside, or the enzyme or fire reside, where the highest digestion of the food takes place.
Right. Correct.
Because liver, duodenum, and pancreas all are related with the hepatic duct.
Right.
So all this, when you combine, there comes the ginger. If you see the shape of the ginger, the shape of the ginger is look like our digestive system.
Absolutely.
And it is known in ethnobotany as a signature of God.
Right. Right.
Okay.
And this is when
one of the drug of choice for good gut bacteria, for the best enzyme, at the same time help the certain enzymes in the body and protein A alpha 368 to reduce the inflammation in the gut lining and help the blood to flow properly.
I take this every afternoon at 4 o'clock Vata time.
Yes,
right.
That is what we are teaching to our student, okay? Because why Vata time? Because ginger has a potency to reduce the air element in the body, by which reduce the inflammation in the body, okay? So that is also another aspect which also we can discuss some other time, Dr. Pai.
Sure.
But here, for this, okay, fresh ginger also drug of choice for the acidity. Why?
Right.
Because fresh ginger post-digestive chemistry as per Ayurveda is a sweet.
Right.
So
and
hydrochloric acid, which is one of the main component, also played important in the inflammation, because
right.
acidity and inflammation always goes together.
So when you're taking bosmeric-sr with all of these ingredients
exactly.
in it, and you're taking it for general inflammation, you have a headache or whatever, you're actually using all of these drugs for so many different inflammations in the body.
Exactly.
Right. It's creating balance, it's helping lowering inflammation. And the idea is that it's a synergy. So one of the things that we'll talk about soon is understand this concept of is not only just having these ingredients, but having them in combination. You know, a lot of people used to take a lot. We used to have studies taking a lot of turmeric by itself, and we had to do grams and grams and grams, and then boswellia by itself, grams and grams and grams. Now we're understanding that all we need is to put the right formulas together. And Ayurvedic medicine is key because where they, similar like Chinese medicine, they understand the concept of synergy by adding, for example, let me just change the slide here, synergy, which is basically 1 + 1 = 3. So we're looking at how do we improve the efficacy of an herb using as a natural medicine by combining it, not just doubling it, but actually it has a synergistic effect. So again, 1 + 1 = 3. Now, going back to this concept of these ingredients, you know, these are great things that you can take orally. We even have available at sanjevanistore.com. We even have the availability for some people who actually can vape it. So they can actually vape these ingredients. It's called Rebel Herbs, and it's called Joint Aid, but it's actually for the lungs. So those people who have lung conditions can take this, and they can actually, people have asthma, they have bronchitis, emphysema, they can actually vape it with a flaxseed oil. There's no vegetable glycerins or chemicals, and actually get an anti-inflammatory effect into the lungs directly.
And it's safe to smoke this.
Well, yeah, because we're vaping it. We're not actually smoking. It's not burning. It's a vaporized way of giving it. But we actually provide the vaping pens and the ingredients. Again, they're all organic, but it has basically, it's almost like bosmeric in a vapor. So those people who have lung conditions, we have that available. So after we come back from the message from our sponsors, we are going to get into something really interesting. Aside of using this anti-inflammatory, we're going to talk about something called Shilajit or Pure Black. And we also want to talk about some other home remedies that people can use for lowering inflammation.
And there are so many other herbs also we can discuss which can really help to reduce the inflammation.
Yes.
Using food as your medicine.
So we'll be right back after and listen to these sponsors, and don't go away.
Yes.
You're clear.
Okay. All right. So now, everybody, just letting you know at home, this is bosmeric-sr. This is our flagship product here. Again, it comes in a bilayered caplet. I don't have one with us here, but it comes, I'll show a picture here pretty soon. But basically, it's going to come in a bilayered tablet, and I'll explain that on the break what that means. But it has a 20-minute onset of action and a sustained release, and we'll explain how and why it differs from other products. We'll also talk about the Shilajit, which is the Pure Black. And if everybody wants to go to Pure Black, PURBLACK.com, that's PURBLACK.com. And if you purchase Pure Black, you can enter a promo code PAI, P-A-I, and get a discount at checkout. So definitely take a look again. It's called Pure Black, and we'll talk about it in a minute. But again, pureblack.com, PURBLACK.com. Now, if any of you have any questions, please email it to us at radio@sanjevani.net. And also, we will answer your questions, hopefully, either on the show or on the next following shows.
You can also go on to Facebook at House of Sanjevani or Twitter at SanjevaniABQ.
Right. And if you go to House of Sanjevani, please give us a like. Please share these episodes and go back and listen to the archives. Anybody that you know that needs to learn about inflammation, that is interested in learning about plant-based diets, anti-inflammatories, please come back and listen to the archives as they're available on demand and available at our website and at iTunes as well.
Share this across the globe. We back?
No, not yet. I just want to show that picture like that.
Yeah.
It's entertaining.
And if you want to study Ayurveda, most welcome to www.
Here we go, coming back.
Sadhana.com. Okay.
Yeah.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Okay, we're back.
We're back.
It's Dr. Sunil Pai here with Maureen and Dr. Bharat Vadia from Ayurved Sadhana, ayurvedsadhana.com, to go take a look at his wonderful Ayurvedic school in Colorado. We were just finishing up talking about bosmeric-sr, the strongest natural anti-inflammatory that lowers inflammation, about 97 different mechanisms within 20 minutes of taking it, and lasts over 8 hours. It is a synergistic formula. And just real quick, before we get on to our next subject, I want to show this bilayered tablet. Why is it bilayered? Just because when we put curcumin and ginger and boswellia into a capsule, the ginger, which has gingerols or any kind of proteolytic enzyme, bromelain, papain, nattokinase, those actually degrade the other ingredients as they sit in capsules. So if anybody buys these products on Amazon and says, oh, it's a turmeric and a boswellia and a ginger product generically, guess what? It actually degrades the potency as it sits on your shelf, and then it just lowers over time. So you're not getting the potency when you take it. This is bilayered, so it protects that degradation. So 100% of this pill is at the time that you take it, when you take it, right? So it's really interesting. Water soluble, lipid soluble, fast acting, long lasting.
And the SR means sustained release.
Go ahead.
And that is what you said, very nice, Dr. Pai, that every herb has a shelf life, okay? And we are teaching over here in Ayurveda Sadhana that all the powder and etc., okay, there is a cellular life. And when it goes down, the way you said, yes, you should be using it, okay, properly, okay, you must know, and it should not expire, or it should not be the way you have explained, okay.
Right. One of the things that we've seen is that in the marketplace right now, about 43% of the generic turmeric on the market is now synthetically being made in China and in India. They can make a synthetic curcuminoid, for example, now. So we have to look at potency, purity. What we're doing with our company is actually they're doing carbon dating. So when we see products that are cheaper than what we can grow on the company's 400,000 acres of turmeric farms in 4 different countries, we know that it's fake. The other thing is a lot of companies will say, 29%, 29 times more, 69 times more, 125 times more absorbable curcuminoids. And we'll debunk those in later shows and also on our YouTube channel. We're going to go through many products one by one and show that they're actually measuring metabolites that have been shown not to have any anti-inflammatory benefits. And these are all just test tube studies. We like to stick with studies that are done in humans to actually show real positive benefits. So let's get to one thing that's really interesting. Aside of these, we were talking about something called Shilajit. And if you can explain what Shilajit is and how that can be beneficial to our listeners with inflammation and just overall well-being.
So Shilajit, it's found, it is actually abstract or the strength of the mountain. It's a resin which is coming out from the mountain. Especially you can find in Himalaya mountains. It might be available in some European mountains, in mountains of the Russia. Okay, some of the best Shilajit you can find there. And I will use this product, what Sunil is showing us, that is pure black. And it is wonderful how you can know that this Shilajit, real Shilajit, that when you put in the body, it should be immediately observed by the bloodstream. And that's what I have seen in pure black. If that is observed immediately by your bloodstream, then it is a pure Shilajit. And at the same time, Shilajit works actually through your water resources in the body, and it is very rich in the mineral, and it has protein and certain protein molecules in the plasma and even in the blood. And especially one of the most important protein, which is a part of the pancreas, Shilajit can help to potentiate it, and at the same time can reduce the chances of diabetes and diabetes type 2 also in the body.
Amazing. So we can use it for so many things. I know that athletes use it for recovery from injury. Yes. We know that people can use it to help with memory. It helps with fatigue. Yes. But now we're looking at, even in the prevention or aid in people that have blood sugar problems.
Gives me wonderful energy.
So it's a nice thing that we can use this as a preventative thing and a kind of a treatment aspect. One of the things that we were talking about before with some of the research and science that's coming out is that in Russia is that the pure black, it actually improves cell response. So what we've seen in the data and the studies and what we've seen in our clinical practice is that say someone comes in and we change their diet, they're moving to an anti-inflammatory diet, and they're increasing their microbiome, they're keeping their immune system up with the glucan 300. But the other thing is that sometimes they stay on blood pressure pills and they're just kind of stuck. And then when we add the Pure Black, after about a month, the interesting thing is we're able to lower their dose and maintain the same benefits because it improves cellular response. So it's a great thing. And explain a little bit more, any other aspects that you recommend with the use of the Pure Black or Shilajit?
And one of the greatest sage and author of Ayurveda, Charak, has mentioned that Shilajit has a capacity to prevent and even to cure all the diseases. Even Shilajit,
all the diseases.
All the diseases. And Shilajit also they have found in the excavation of the Indus Valley civilization, Mohenjo-daro and Harappa, they found the big ball of asphalt or Shilajit, and it must have been brought there by the Himalayan valleys. That is what the scientists are believing. It works excellent on kidney, and it take out the toxin from the body. It reduce the toxin from the blood, and at the same time it is excellent anti-inflammatory, and it has a capacity to prevent, the way I told you, the bad sugar in the body and maintain the healthy level of the cellular biology and the blood.
Wow! So this can be used for healthy patients. It can also be used for patients who are sick. I noticed that some research that I was looking at recently, coming about use in cancer patients, can be helpful for those people undergoing radiation therapies. Or here, for example, it's just eliminating the toxins. It's helping support cell function with adaptogenic neurotropic effects, anti-diabetic effects. So what a great thing that we should be taking. So I would say it's our trifecta would be, making sure people are eating an anti-inflammatory diet, number one. Number two, taking a glucan 300, which is a polysaccharide naturally for improving your immune system. Number three, taking bosmeric-sr, the strongest natural anti-inflammatory available, and taking Pure Black to actually enhance all of those things, but also have its own unique additional benefits.
Maybe we can talk very quickly about some foods that also help with inflammation.
Yeah, real quick, since we're running out of time, bring some few examples that people can use in their kitchen, certain spices, anything else that you can recommend for lowering inflammation today.
I will also recommend actually two things I will recommend.
Sure.
One is one very famous over here, which is licorice.
Wonderful.
Ooh.
Licorice is excellent anti-inflammatory. Licorice is an excellent microorganism. Okay, licorice is excellent for the viral, and licorice, especially now when the flu season is going on and people are suffering from so much viruses and sore throat, licorice can be drug of choice. Licorice contains vitamin A, B, B1, B6, B9, B12, flavonoids, and so many other important components. And Sushruta has mentioned licorice in the Jivaniya Gana, means life promoting herb. Okay. And licorice has a potential to reduce the inflammation. If these children which are going to school and they are unable to go to school because of this flu and outbreak of flu, licorice with honey can be the wonder drug for our children. At the same time, if we go to the British Raj, the mother used to saute seed of the licorice, and those licorice seed they used to give to the children in those days for the hoarseness of the voice, at the same time for the infection and infestation in the voice. And that is where also what Dr. Pai is coming, that inflammation is one of the major problem over there, where licorice can play important role.
Wonderful. So licorice is something else that we can add. I know cumin would be something that we're running out of time today, exactly, but we'll talk about that on another episode. Yes. But licorice, so people have licorice teas. There's actually licorice powders, and if you do take a supplement, it should be deglycerized licorice so that they don't get any problems with blood pressure if they take too much. We're not talking about licorice candies now. We're not talking about bad stuff.
Yeah, licorice, and yes,
licorice the root.
Too much if you are taking, then it is a problem.
Right.
Little bit licorice, okay, it is excellent for the your body, at the same
nourishing
respiratory.
Right, Dr. V, we're really excited that you are here to join us today. We will definitely have to invite you back because there's so much more to talk about Ayurveda.
I'm honored, Dr. Sunil and Marine. I am honored.
Yes.
Okay,
It's always my honor to be with someone with such great knowledge. If you think I have knowledge, this guy, like, he even knows the pages and the text numbers of 7 generations of Ayurvedic medicine. So everybody, I'd like to thank you all for listening today. Again, I'd like to thank our sponsors for helping us provide the show, and all the listeners worldwide. Please like us on Facebook at House of Sanjevani.
I'm so happy that all the listeners from the worldwide are joining us over here. Okay, very happy to meet them all and sending my regards to them. Okay, and please send us your blessings also.
Yes. Okay, everybody. See you next week. Best of health. This is Dr. Pai and
Maureen. Okay, bye, Marine, Dr. Pai.
Thank you.
Namaste, namaste, namaste. Most welcome.
Namaste, everybody.
Most welcome. Most welcome.
All right, we're clear.
All right, everybody. We're here on Facebook Live. We just finished our show. We do have some time. So even though the show is finished on the radio, we do have some time. So let's just see. Let's see if we get any emails or not. We have to connect
with
here.
questions, etc.
So we can still continue to talk. Let's talk a little bit about, you mentioned licorice. So for the Facebook Live audience, we have a few more minutes. So why don't we talk about what else they can talk about?
Like cumin or almonds.
So tell them a little bit about cumin and almonds. We'll carry this on for about 10 more minutes.
So cumin, okay, the way this curcumin lunga or turmeric is in the market, same way cumin has excellent effect on the blood, the plasma. At the same time, cumin works very good on the bone marrow.
Oh.
Cumin tea is excellent, okay, for the GI tract and good gut biome. It helps the certain protein, at the same time certain carbohydrates and fat molecules in the body.
This would be wonderful for maybe menopausal women who are beginning to lose some of their bone and have upset stomach, GI issues.
Yeah. And at the same time, the way you said that it is excellent for the menopausal woman, and at the same time, it is excellent for the every age of woman. Why? Because it helps the liver, and liver, the uterus and the breast in Ayurveda are the substrata of the blood and plasma, and seat of the blood and plasma is liver and the heart, and cumin can work excellent over there. Again, I told you all the enzymes, lipase, pepsin, erepsin, cumin can help and promote them.
Wow. So that's a great thing. And that's why when we cook, right, the first things that we put is, coriander, cumin, turmeric, ginger, a little bit of the black pepper. I mean, all this is usually the base of a spice or a curry sauce, or just, cooking in general with a little bit of oil heating up in the pan, and then we throw the rest. So that's usually the combination that is really important. So food is medicine here. And if people eat these things every day, or they utilize them. And one thing that we will be doing soon in the near future is opening up a plant-based restaurant at Sanjevani, where we'll be able to incorporate, food as medicine. And more importantly, we're going to be doing a retreat coming soon. We'll announce it probably on the next show. But we're going to be doing a retreat in Curacao, the wonderful island of Curacao.
It's so beautiful there.
So beautiful.
Oh.
It's it's the wellness island, and we're going to be talking soon with the Minister of Health and one of the presidents of the university.
That is so cool.
It is so cool because we're going to develop a whole community, a medical school, a hospital, villas, clinics, summer homes, rentals, houses, all sustainable, eco-friendly.
And the entire island is a wellness island. What a wonderful destination.
Yeah, we're going to definitely be probably broadcasting from there in the future. But again, everybody sign up at our website, sanjevani.net, SANJEVANI.net, and then sign up for our newsletter. We'll keep you posted.
Because of Dr. Pai, this is where I came, with the idea, and this is what one of the homework, what Marine also, if she has to also do in the Nigantu, that certain house, or certain, you can say there is a colony, and if you go and ask them that how much spices they are using in day-to-day use, and that will be so much important public health data, And the way you say food is a medicine, and this is where it all comes, okay, and get together.
Wonderful. So everybody, you know, please visit Dr. Bharat Vadia's website. It's Ayurved Sadhana, AYURVEDSADHANA.com. Ayurved
One of the
Sadhana.
faculty is Dr. Pai is also, okay, and one of our student or senior most student is Dr. Marin also, okay.
Yeah, so Maureen's working on getting her advanced studies in Ayurvedic medicine, and anybody who's a healthcare provider or anybody interested in understanding and learning Ayurveda, please take a look at his website and join one of his programs. Amazing, better than any other school, and you know there's a variety of schools. There's even schools here locally in New Mexico. I don't recommend anything that's not his school, because this school is as far above everybody. It's just up
And
here.
I've
Everybody
been
else's
to
schools
many.
here, because we've seen them all, we've visited them all.
And the way you, Dr. Pai, you say that Ayurveda should now look up from the Vat Pitta Kapha, okay?
Right.
Go ahead, okay? And that is where all these are coming.
Right.
Moving forward.
And it's a world-class school, world-class education, actually Department of Education. It's one of the very few schools that actually are formally through a Department of Education, not just run through some kind of religious nonprofit organization. So that's something to be said about the curriculum and the standards there at Ayurved Sadhana. So Dr. Bharat Vadia, I want to thank you for joining us today. We'll bring you back definitely for other discussions, because we're going to be on the air. We're going to have a lot of episodes. So we'll talk more about other Ayurvedic medicines and other parts of Ayurveda, even yoga, meditation, and other types of things.
I'm really looking forward to the upcoming Nigantu classes. I've learned so much. I love it.
Good.
Most welcome. Most welcome. We all enjoyed a lot. Even this postpartum, okay, cooking and everything, we were all enjoyed a lot. Yes, we missed Dr. Pai, okay.
Yes. Oh, yeah. And one thing last for all the Facebook Live watchers still is that when you take these courses, it's not just learning the text. It's not learning actually how to do a physical exam. It's not learning just the history, but they have wonderful, amazing cooking classes.
Oh, my God.
Bharat's wife, AV, is just an amazing cook. And they actually teach you. You actually have hands-on. You go for courses of how to make the food, the medicine, how to prepare foods for the body types, for different illnesses, how to use the spices, just directly hands-on. It's one of my favorite things to do. Is I go up with Maureen, I tag along and just be in the kitchen and learn how to make food as the medicine. So it's not just always taking supplements. It's actually how to remember supplement the diet. There's nothing replaces the best quality of using food as medicine.
And not just the foods, but to learn how to make the medicines themselves. And that's all hands-on. And some of them are very ancient recipes that no one else has.
Right. And then Dr. V will be helping us, just letting you know for other people. We'll be coming out with some more Ayurvedic formulas. We'll be working with some companies that are releasing some CBD, cannabidiols from industrial hemp, which we consult for. And he's going to lend his knowledge with the ancient Ayurvedic medicines, what to add with CBD to make it better, to make it enhanced, to make the balanced. And so a lot of things coming ahead. Thanks everyone for listening and watching today on Facebook, and catch us on voiceamerica.com health and wellness channel every Monday at 1 p.m. Pacific, 4 p.m. Eastern. Thank you everybody, and take care. Best of health.
See you next week.
Thank you very much. Okay. Namaste.
Namaste.
We are done.
We're done.
Okay.